But several years ago, we realized that there were numerous applications for this core technology where the technology was very well suited. And those tended to be tissues that were not properly regenerated by the body. So we've done a lot of testing over the last several years to proof of concept testing, as well as some developmental work to look at applying this technology to various soft tissue disorders where the soft tissues are in need of repair, where the surgical treatments are insufficient or inappropriate. In snoring and sleep apnea, the soft palate, the tissue that extends from the roof of your mouth, is implicated as perhaps the primary tissue responsible for high amplitude, low frequency snoring, which is the damaging type of snoring, and obstructive sleep apnea, where that tissue is overly compliant or flexible, and because of that it collapses and interrupts the breathing cycle in the midst of sleep. So we have approached this issue of treating the soft palate and testing for efficacy in a number of different ways. One of the ways we're treating the soft palate and testing the treatment on the soft palate is by use of a wind tunnel. This is the wind tunnel that we constructed to test in the laboratory the effect of our treatment on reducing the deformation, the flexibility, the flapping of the soft palate. And essentially this device is fairly simple. It's not that beautiful, but it's extremely functional. We're able to create the amount of wind flow that's similar to the wind flow in the upper airway when a person is sleeping, and especially when there is some narrowing of the airway and you have a higher velocity of air traveling through the airway. We mount the soft palate in the center part of this transparent part of the wind tunnel. We have a laser which is measuring in a non-contact fashion, measuring the deflection of the soft palate as the wind is drawn by the fan through the wind tunnel, so that we can look at the overall deflection of the soft palate as well as maximum local deformations, because this relates to potential damage to the soft tissue by the wind flow. Our results from the wind tunnel testing went beyond our expectations. We found that the effect was dramatic. We've got proof of concept, thoroughly evaluated, and we are now fine-tuning that technology for clinical applications in humans. And these technologies are moving rapidly towards commercialization.